My name's Amy Feith, and I'm the Executive Director of Carousel Child Advocacy Center here in Wilmington, North Carolina. And like most child advocacy centers across the country, our job is simple and not so simple. So we are providing child advocacy services, which includes forensic medical evaluations for kids who have been physically and sexually abused, as well as providing family advocacy and trauma treatment services and prevention education for child physical and sexual abuse. And basically our job is to work with law enforcement and DSS partners with our district attorney to hold perpetrators accountable here in the community, Pender, Brunswick, and New Hanover, as well as trying to help kids do that hard work of healing so they can get back to just being kids. The ABC Commission's grant is really helping to support that trauma treatment piece of what we do. And we use evidence-based models because we're a National Children's Alliance accredited child advocacy center. And so what that means is that every one of the treatment models that we use has to be an evidence-based treatment. And evidence-based means that it is tried and true. There is research that backs it up that says that when you use this model, it actually helps children to heal from the trauma they've experienced. And so it is really important for us to have the best and the brightest therapists that do that work, but those folks come at a cost. And so we want to make sure we have the best and brightest that the Cape Fear area have to offer. So this grant from ABC Commission specifically helps us to augment those cases where we don't have any other way to ensure we've got a good infrastructure. Right now we run a waiting list because a lot of times folks are needing to get trauma treatment at varying ways and levels. Not every child needs to have trauma treatment, and so what we need to do is make sure that we've got trauma therapists that are of the caliber that Carousel Center needs in Brunswick, in New Hanover, and in Pender, with enough of them to be able to see the volume of the children that we have needing it. So what we hope to accomplish, in addition to providing additional or to provide expanded services for trauma treatment for kids who have been physically or sexually abused, is we'd also kind of like to test a hypothesis about, in partnership with the ABC Commission, really looking at how many households of kids that we serve or families that we serve do have situations where our adults in the household have coping mechanisms that might include alcohol, prescription medications, or other illicit substances that even the adults are having unresolved trauma and they're resorting to, like many of us might resort to, specifically alcohol as a way to cope with whatever it is that are stressors going on in their life. And that's a modeling behavior that we see that children are going to also pick up on. I think in America that's a very typical built-in model for how we as Americans, celebrate and cope. And so in this particular year, one of the things we'd like to look at is getting some quantified measures of what that actually looks like specifically in households where trauma is known to have occurred. And how do we help to make sure that we're doing our due diligence to educate about the impact of alcohol and its ability to also create additional stressors for families where trauma has been part of that household's lived experience.
New Hanover County ABC Board is honored to award the Carousel Center $75,000.